able to solve all the problems, I don't think we should live in utopia where a couple of crores of venture money will be able to solve all the problems known to mankind. However, each of these have a role to play. For instance, when you go ahead and say that touch is not there, whom are you comparing with? You're comparing with yourself, because you have the ability to go to a doctor who can touch your pulse and tell you whether pulse is there or not there. But you are not comparing yourself with the mechanic living in a small village in Gujarat who might not have that facility unless and until he travels to Ahmedabad in any case, which means that the mechanisms of comparison or the spectrum of comparison has to be different for every patient.
So how are you going to take the touch feedback?
Already, just to give you some insight, iPhone now is coming out with an app. One of the developers in the US who's very closely known to me is coming out with an app by which they are developing an app which already, if you blew into the iPhone, it would give you your lungs tidal volume, which is the amount of air that your lung can hold, with 82% accuracy. Right?
But the problem is...
allow me to complete, sir. Just one moment. Please allow me to complete. So if it is possible to do this with technology today, where the physical spirometers there in the hospital chamber gives me only 90% accuracy, whereas the one in the iPhone gives me 82% accuracy, in a country like India, where healthcare has so many peaks and troughs, should I be willing to live with the 82% accuracy for the time being? So that's the question. The mechanism and the spectrum of comparison has to be defined before we compare.
Okay, thank you.
What is your revenue model? Is it subscription-based or...?
Just like a hospital. So in a hospital, what happens is when you walk into a hospital and you consult with Debraj Shome, I am, for instance, at Breach Candy right now, right? You would pay me 1,000 rupees. Part of that would go towards my fees. Part of that Breach Candy hospital would keep. Similarly.
You don't have a subscription-based...
You have a subscription-based as well. In an e-healthcare, you can do that. You have subscription-based, you can monitor, you can provide preventive to certain people who you know are developing certain sort of problems or likely to develop certain sort of problems. And that's the good thing about using technology over having physical records.
This is, as a member of a political party, let's say there's a big slum and we're interested in getting quality healthcare for all of them. Can we enroll all of them with a small subscription fee and then...
Yes. We are already doing that for corporates, not really for the slums. We are struggling to survive ourselves. Young companies have a tough time surviving themselves. But we are already doing it for the corporates and for the insurance in any case in India. I'm sorry? It depends, like I said, on the type of service that you're trying to provide. It depends on the population that you're trying to cover and the risks therein. For anything like this to succeed, the sum of the parts has to pay for the entire whole. Otherwise, it will not succeed.
Thank you very much. Thank you very much. Dr. Debraj Shome is someone actually who, that he didn't tell today, but I know much about him. He doesn't stay much in India. He travels abroad. And he has operated some of the top actresses and celebrities all over the world. And today he touched upon something on MediAngels, which is his pet project he co-founded with Amrinder. Is there? He's come? Amrinder is not come. Okay, right. So he's one of the known faces in plastic facial surgery. And he's traveling abroad and doing a lot of operations over there. And he's also working on some breakthrough research which is not yet come out and which is planning to have it very soon. That's what I've read it in various papers and everything. And the MediAngel is something which is actually very unique in terms of online healthcare where the interactions are much there. But I think it's still in infancy to gain its momentum. So I will urge all of you to support MediAngels initiative because it's combining all the doctors in one platform and trying to make a difference because healthcare is the key issue as I addressed in my opening address. So let's give a huge round of applause to Dr. Debraj Shome. Thank you very much. Yes, can I have the memento, please? Thank you very much. It was a wonderful presentation. Thank you.